Welcome back to the Front Page Saturday Town Hall Edition. This episode, this program dedicated to the memory of Representative John Lewis, the conscience of the U.S. Congress. It's being brought to you by the great city of Los Angeles, Council President Emeritus Herb Wesson, Community Build, and the Independent Professionals Association at indiework.org. I am Dominique DiPrima. We're being joined now by the founder and CEO of OmniPathology Solutions Medical Corporation. It's a physician-owned, Pasadena-based company that specializes in providing academic-level, state-of-the-art pathology services. Dr. Mohammad Kamal, welcome to the show.
Good morning, Dominique. Thanks for having me on your show.
Thanks for waking up with us on a Saturday. So much to unpack here when we talk about this idea of controlling COVID-19. So from a testing standpoint, because that's where the lab's, pressure point is, right? I'm reading so much that we here in the state of California are only testing at about 34% of the level that we would need to be testing to be able to get coronavirus under control to the point of being able to function, not going back to the way we were before, but going back to a new normal.
Right. Testing is the biggest challenge in controlling this virus. If you look at other countries that did well in combating the virus, if you go back to looking at, for example, Germany and South Korea in particular, they have done relatively better because they have been testing much more liberally. I think one of the challenges, of course, is the availability of resources for testing, and that comes from, if I just describe a little bit the testing, we're talking about PCR testing. That's what we do at OmniPathology. So the testing requires a swab, a preservative fluid in a tube, and then it goes to the lab, and then the laboratory runs it using PCR kits. PCR kits is like a testing that requires extraction of certain nucleic acids and then running the test so you can decide whether the sample is positive or negative. So when we started this, there was a massive shortage, and the shortage was in the swabs, the testing kits, and in the extraction kits. And everybody went to work, and we started to get to find resources, and we find, of course, that there isn't enough to test. And I think that this is probably what resulted in the earlier recommendations that you should only test symptomatic individuals. Well, because this is a virus that can be transmitted by asymptomatic carriers, we have neglected testing the other sector that could really transmit the virus. So the recommendation was based on shortage, not based on really a true scientific fact. And that's really what we're paying for right now. And we continue to pay for it because, as you can see, it became a vicious circle where you're having shortage, you're having asymptomatic, untested individuals that transmit the disease. There's a spread of the virus, and then the shortage becomes much more signified. So I think that this is the biggest challenge. I think the way to combat, of course, with the availability of the virus, of the vaccine down the road, will be in finding resources to test as many individuals as possible.
Yeah, I mean, I'm just looking at the idea, of how do we reopen schools in California and, testing kids, and what happens when a kid, tests positive? Do you shut down the whole school? Do you test every kid? And it seems like that's going to be a key. That's just one key factor, but that seems like it's a place where we are going to have to get a handle on testing. What's it going to take to do that?
Right, and actually, to your point, you test a child, but this child also lives in an environment that needs to also be tested. Like when if the child is tested at school, the staff is tested, but this child goes home. The family has to have testing available to them. So that's really the challenge, is that we interact in different environments, and that means that the availability of testing is required So we're trying to basically put a lot of work, and we are facing difficulties because, for example, the vendor who provides us the PCR testing kits is telling us, well, we have allocation. You have a certain number per week. We can't give you more. And even with that number, which is not enough, they don't even deliver. So we run into these continuous problems that every day. What we are doing is that we found that we had, when we started testing, we started because we felt that this is a responsibility. As a high complexity laboratory, we felt that we have to find a way to help in the problem. So we developed our test. We submitted it for FDA authorization, and we were basically making it available to test everybody who needs. And then as the economy reopens, we found that there is a tremendous value of having a test that allows, for example, physicians who have suspended their elective procedures to reopen, allow them to provide services to patients that need those services by testing patients before procedures, testing staff before the office opens. We have a lot of companies now that are asking us to help them test because they want to test the staff when they reopen and also have some sort of a continuous testing program. So as you could see, because everybody lives in an environment and they go home and whatever is in that environment could be transmitted to their homes. So that's why we have to have availability of testing, and it has to be offered to those, not only to symptomatic but to asymptomatic. I know that the need now is requiring certain guidelines that requires that it has to be offered to symptomatic individuals. And I think as tests become more available, I think everybody who is about to engage in work, school, medical care, they need to be tested.
All right. I have a lot of people with questions on the phone, so I'd like to go to the phones, but it's interesting hearing you because it points out that it's not just about the capacity of the labs to get these tests done. It's about the supplies that the labs are not getting, which makes you wonder why we can't, in this mighty country, get, corporations to pivot and start manufacturing those equipment pieces that we need for this puzzle. We're going to go to Edward from Nashville, Tennessee, calling us. Good morning, Edward. You're on with Dr. Mohammad Kamal. Welcome.
How you doing, Dr. Mohammad? I'm actually asking a question because a lot of the businesses now, they're scanning you, checking your temperature and so forth. Now, what happens if you're in a particular location and you scan someone and their temperature is showing that they have a symptomatic situation going on based upon their temperature? Now, this person here is potentially exposed to other individuals. So what are the procedures that are going to be in place should that ever happen if someone...
Right. So what are the protocols if I am trying to go on a plane or trying to go into a place, a doctor's office, and then I have a temperature? What happens then? Is that the question?
Yes, exactly.
Okay. What's going to happen to me? Do you have an answer for that? And maybe it varies from business to business.
Sure, I will give you my opinion. Just to give you a disclaimer, I'm a pathologist. A lot of these questions are best answered by epidemiologists and by physicians engaged in the direct care of patients. But I can tell you that if somebody is having temperature and that person is not tested, the best approach is to assume that this person is positive and start to find ways to get that person tested, and also make sure that this person is isolated and not in contact with other individuals, whether at home or at work. That's really the first step, because if somebody is having fever in this time, it's the best approach is to assume that this person is positive. And we actually say that even to people who test, that we say if there is an exposure, let's say you got exposed to someone who later on was found to be positive, we basically say you need to be tested. But then when you are tested, even if you're negative, it is always best to say that for a period of time after the exposure that somebody needs to be quarantined. But the specific answer to your question, if someone is having a fever and is not tested, the best approach is to assume that this person is positive.
I mean, I've been hearing that we just need to assume everybody is positive at this point as a way of staying safe.
Sure.
Let's go to El Nubian calling us from Los Angeles. Good morning. You're on with Dr. Mohammad Kamal, of CEO of OmniPathology.
Hey, Dominique and Doc. I was wondering, is this something to worry about as far as people taking their time to come up with this vaccine, but administering it? Like, I'm thinking they should try to, have like something you ingest, something you inhale, or maybe something like a patch that you absorb, because I think we're going to end up just like with the AIDS epidemic, not knowing what to do with a lot of the waste, I guess you might say, like the syringes. If we use syringes, and there'll be a lot of syringes we're going to be using, and how would we get rid of those things like that?
Got it. So you're worried about the waste that's created by having a vaccine. I mean, I can understand that. I worry about all these gloves and masks being discarded everywhere in the environment. But what's the alternative? Oh, we're going to just let people get sick and die because, it's a tough...
It's sad, Dominique, that people from California are being ridiculed about wearing masks. I
got you. Okay, so let's allow Dr. Kamal to respond to what you're saying. He's worried about, the planet, I guess, and all of the, all of the waste that is created by the products we need to stay safe, including a vaccination.
Right, and I can see that concern. The only issue is that if this is, you have to think about the alternative. I think it's really important for us to do whatever we can with whatever means we have. So I know all of this waste created is created, but in the meantime, you're addressing a health crisis, and if there is a more biologically and environmentally friendly options, of course we should pursue these. But at this point, we're dealing with the best with what we have, and we have nothing is perfect, and we're far from perfect.
Yeah. Okay, let's go to Willie calling us from Palmdale. Good morning, Willie. Welcome.
Good morning, Doctor. How you pronounce your last name?
I'm sorry. What are you saying right now?
I was saying, how do we pronounce his last name?
Kamal. Dr. Mohammad Kamal.
Yes, I want to ask. I hear that some people in Europe they are immune to AIDS, and I was wondering, because they have a special gene that keeps them immune from AIDS, could they do a study on that new gene and come up with a vaccine, since both AIDS and corona attacks the lungs?
Interesting. Willie's got a line of thought where, because we're reading that there is some relationship between HIV and COVID-19, and because he has read that there are people that are immune to HIV, can we take their genes and use that to create some kind of treatment or cure or vaccine? Scientifically, I don't have an answer to that, but I can see I have a colleague of mine who mentioned that there is a certain HIV positive individuals that are taking certain medications that have somehow maybe have not been testing positive, but I don't know how scientific that is. But I think it's too early for us to make a judgment on these issues. So it's very difficult actually to speculate on this. Yeah, it is. I think, there's a lot of speculation going on, but what I know for sure is that right now you pretty much have the whole world in terms of science trying to come up with a solution. So I'm pretty sure if there's any validity to that, somebody somewhere is trying to figure it out. I just, I've never seen the world shut down like this in my lifetime.
Right. And again, the other thing that I was going to say about shutting down, and as you see the surges, I think the first response to the initial hit by the virus was to shut down. But I think now with testing, there may be a chance for us to have some kind of limited reopening that can make, for example, one of the things that I saw in my practice, I'm a gastrointestinal pathologist, so there's a lot of endoscopy procedures like colonoscopies and upper endoscopies that were suspended. in April. And we started actually seeing that those individuals, even though they are called elective procedures, basically that you could be postponed, we have seen increase in the number of cancer cases that we're getting in May as things started to reopen. So even though they're called elective, there is a need for those patients to get care. And what I think will happen is that as you make more tests available, there will be some availability of medical care, for example, or some businesses opening knowing that they are testing customers, testing staff. So it's not going necessarily to a complete shutdown, but I think the more testing you have, the more ability you have to have some kind of limited opening.
You know, interesting you said that, because I have a friend with lupus who won't go and get her normal lab work done that she's supposed to do because she's afraid of COVID. And it just worries me because, you know, people need to take their medicines and they need to stay on their regimens even in the middle of this pandemic, right?
That's true. That is true. Yes.
So, you know, what would it take? I mean, okay, two questions here. So let me rewind a little bit. First of all, to get up to capacity, what we need, if we're at 34% of how much testing we're supposed to do in California, that's a long way off from where we need to be. Sounds like we need all hands on deck. So how do we get smaller firms, you know, independent companies like your own that that we need to have really on deck to get up to capacity? How do we make it easier for them to be part of the solution here?
Well, we hear a lot about, people saying that the government is not doing this, the government is not doing that. I can tell you that I have never seen anything from any government since I started testing. You know, when it comes to testing, there is nothing. I mean, there is nothing that I am seeing as far as help from a local or state or federal government with testing. This is not happening. So, but the question here is that we, as local laboratories, are helping our immediate community in Southern California. Now, when you go on TV, you watch, bigger labs, national labs, their CEOs are meeting, and we're hearing promises, and we're hearing that I feel like they're having access that we don't have. So it doesn't help for someone like me to question, why am I not getting my kits? Why am I, if I'm being allocated a certain number, why am I not getting double that number, knowing that I am a local lab and I'm helping a community that is hardly hit. So I think that there is need to be, we need to look at this at a local level, because that's really where the tangible change will take place. Today I have customers calling me all the time telling me, when am I going to get my result? We have a philosophy, and it's based on a very strong scientific fact, is that this test is not the kind of test that you could or you should report in 4 or 5 days. This is a test that, because it's transmitted by asymptomatic individuals, everybody who gets the test needs a result in 24, maximum under 48 hours. That's what we want to do. That's what we have been delivering. And that helps, because when you give the results right away, that individual who's going to test positive, is going to be isolated and is not going to infect others. So we need to see some more work on a local level. And that means we need to have advocacy by our local governments. That's number one. And nobody's asking for handouts or financial help or anything like that. We just need to get the kits that we need. We'll buy them. We'll pay thousands of dollars for them. Just give us those kits when we ask for them. When you allocate what we want, not just give us small because there's some other national labs getting thousands and thousands of those kits. So just to think on a local level, and if they think at a local level and help local labs, and we should get some kind of advocacy from our local governments. That's all what I think. That's basically the first level of help that we can get. The second level, of course, will come from individuals, and which is, to have responsible behavior and to follow guidelines and to wear masks and to act in a responsible way so you to prevent the spread of this virus, because it becomes a burden on the system when you have so many cases. And I can see everybody knows now that this is not an easy virus to handle, and it can spread, and even though and people die when they get the virus. That's really so I think that there are things to be done. The situation is not as bad. I think I am very optimistic about our ability as a nation to overcome this. But the sooner it happens, the better.
Yeah, a lot of great points there. I mean, and when we hear about, the president saying, well, if we test more, then we have more cases, that sort of doesn't make any sense. When we test more, we know how many cases we have. That's really what it is, right?
Exactly. And yeah, I mean, this is, I listen to science people when it comes to testing. I don't really need to listen to politicians, but I think the idea is basically we have to follow CDC recommendation and make decisions based on scientific facts, not based on anything else.
And, and the other piece that you pointed out, Dr. Ghali in the governor's office was saying, yeah, we got to get quicker turnaround because you don't know how many people that person has infected between the time they're tested and the time they're getting the results back. And that's, especially a concern, as you point out, because people might not have any symptoms. They might just be walking around. So it's a great point. As a mom, though, okay, we're not going back to school right now, but how would I, when we get to that point, how would I protect my kid? How often does my child need to get tested? How often do I, as an essential worker, need to get tested?
That's an excellent question. I am not really sure guidelines specifically with schools. I'm not sure what is the most current one is, because I think there hasn't been a lot of school opening yet. So I would say that it's going to be tricky, because I think the entire environment needs to be tested. So when we talk about that, we say it's not really going to be random testing, right? It has to be every student, every staff member, correct? Mm-hmm. Then at home, what happens? And then are there other activities in which the child is potentially exposed? So if we think about the school, I think the school environment is not going to be fully controlled just simply because students go home, right? So the frequency of testing, to determine that frequency, I think is going to be very difficult. I'm sure that CDC is probably looking at something like that, and they may come up with something that can help parents, at least to the best of their knowledge, to do something about it. But I can tell you that before the school opens, probably there is a need for testing, and then going from there, I think it's going to be something looked at. It's a very complex situation that I don't think anyone today can answer with any sort of certainty.
Well, Dr. Mohammad Kamal, CEO of OmniPathology, thank you so much for joining us this morning and sharing your knowledge with us.
Dominique, thank you so much for your great work and, fantastic job, and thanks a lot for having me.
We will continue our conversation. Controlling COVID, vaccines, cures, testing, antibodies, contact tracing, treatments, all that straight ahead. It is Radio Free 102.3 KJLH.